Good afternoon. I'm Michaela Miller with the Tuesday edition of the Our City COVID-19 News Show. We will be updating you on the latest information and resources around the COVID-19 pandemic while unpacking deeper issues as they emerge. We encourage you to get in touch with us. We want to hear from you as we welcome contributions from providers and healthcare providers. Today is International Nurses Day as nurses around the world are being commemorated for their contribution to society, especially during this pandemic. Here at home, Health Minister William Kize honored our nurses at the candlelight ceremony via Zoom. Later in the show, we'll also discuss the estimated 1 million domestic workers and gardeners in South Africa and the uncertainty about their job security during this lockdown. Under level 4 lockdown, the government has granted permission to some domestic workers to return to work. And now for the news. It is day 47 of the lockdown and the current number of confirmed COVID-19 cases nationally stands at 10,652 with 4,357 recoveries and 260 deaths. This Western Cape is currently standing at 5,813 confirmed COVID-19 cases, 1,796 recoveries and 106 deaths. A cleaner self-isolation has accused the Tygerberg Hospital of endangering the lives of staff. This comes after they were instructed to use bleach to sanitize the ward where a nurse who recently died of COVID-19 worked. Ntobizagiti Ngidi was the second nurse in the Western Cape to die after testing positive for the coronavirus. Tygerberg Hospital spokesperson Letitia Pinar said the ward where Ngidi worked had been decontaminated, followed by the cleaning of the terminal at the weekend. She denied the cleaner's claim. The Western Cape Liquor Authority has conducted 51 investigations into the non-compliance with the national disaster regulations and found that a number of liquor traders have been contravening lockdown regulations by selling alcohol. Now 20 liquor licenses have been suspended and 2 reports have been referred to the Liquor Licensing Tribunal for consideration. Community Safety MEC Albert Fritz said the illegal sale of alcohol would not be tolerated and would be investigated. Fritz added that members of the public who were aware of the illegal sale of alcohol should be reported to SAPS, and any persons wanting to lodge a complaint or report a contravention of regulations can contact the authority on 021 204 9805. Today is International Nurses Day as nurses are the frontliners in fighting COVID-19. Health Ministers William Kize and Health MECs from the 9 provinces held a special candlelight ceremony for all nurses in the country via Zoom. We spoke to Eleanor Roberts, chairperson of Democratic Nursing Organizations of South Africa in the Western Cape, about the tribute they had in Bellville.
Hi, I'm Eleanor Roberts. I am from Western Cape. I'm the provincial chairperson for the NOSA, Western Cape, overlooking the nurses here in Western Cape as the Nurses Union. We are celebrating our Nurses Day today with nurses right through the world. And it is in commemoration of one of our nurses, Florence Nightingale. It is a birthday. And so we are affiliated to the International with the World Nurses. We celebrate her birthday today. And it's a big day for us. As a nurse, very proud to be associated today as the leader of this province, as the leader in our with our shop stewards, with our members, so that we just want to thank them for what they are doing. We all know what pandemic that we are finding ourselves in today. So just to support them. International Nurses Day is usually a very a, it is a day that we are very glad we're looking out for it on a yearly basis. Last year, this time, we would not have known that we would have found us in this pandemic. And in this pandemic, in this time, us as nurses, we are very sad. We actually that we have it to celebrate in this manner that we are celebrating it in. Because we have lost nurses along the way. There is a lot of issues that is happening with our nurses. Our nurses feel that they are not being valued at this time of today. So it's, I would say, we celebrate it, but there is a sad tone to it today. As you know, we've also lost nurses in Western Cape, and that does not sit good with us in Western Cape as members for us. And I just want to say for everyone, for our members, even for you, stay safe. And that's the message that we can bring across to you. Just look after yourself, to our nurses. And thank you for everything again that you are doing. As unions, all I can say that looking after human rights aspect and our occupational health and safety aspect that is not being looked at. As a trade union, we are there to fight for your rights, and we have to stand for the nurses. So we will do. We're gonna celebrate and light a candle for two of the ones that has fallen. I'm on my way there, so we will be online. Thank you so much.
The Red Cross Children's Hospital is usually busy during this time of the season. The hospital is expecting an escalation in child's patients with diagnosed respiratory diseases during the COVID-19 pandemic. The hospital's emergency center and paramedical services head, Heloise Baez, said staff were concerned about children with weakened immune systems who could be more vulnerable to contracting the virus. The COVID-19 pandemic had made life more complicated for everyone, she added, and preparation was key to deal with what is to come. The Pedal Power Association, one of South Africa's largest cycling organizations, together with the Cape Town Cycle Tour, have raised concerns over the large number of cyclists not adhering to the mandatory use of face masks when on the roads during the daily outdoor exercise window. Chairperson of PPA, Rens Rizalman, said despite the well-advertised government regulation that compelled all citizens to wear masks during level 4 lockdown, there was a clear lack of discipline among cyclists and others when exercising. Cyclists were urged not to be a part of the problem, but rather be part of the solution. Now it's time for an ad break. We'll be back shortly. Welcome back. You're still watching the Our City COVID-19 show with me, Michaela Miller. We will be giving you the latest updates on the COVID-19 pandemic and sharing essential resources and information with you. Domestic workers are among the hardest hit during the national lockdown. Thousands of women from mostly low-earning backgrounds with little or no formal education work in the sector. While the field still remains mostly unregulated, it is hard to establish how many have lost their jobs due to the pandemic and how many have received aid from the Unemployment Insurance Fund. To give us a better understanding on this matter, we spoke to Myrtle Witbooi, General Secretary of the South African Domestic Service and Allied Workers Union, about these challenges.
Good morning, Myrtle. Myrtle is the General Secretary of SATSAU, which is a labor union that tends to the rights of domestic workers. Myrtle, under level 4 restrictions, can domestic workers and garden service providers go back to work?
The problem that we're having now is that domestic workers, as you know, are a scattered workforce, and many domestic workers that sleep on the premises has returned home. However, when they got to stage 4, there was a country that domestic workers that went to the country can now return to their workplaces. So many domestic workers has returned to work and is now at the workplaces, but did not realize that when they are at the workplace, they actually now have no access to go out on weekends or so. So that is the first problem we encounter. The other problem we have is with the domestic workers that can only return at stage 2. So currently Satsao is having a lot of problems with those workers. Also, we are having a lot of problems with the unemployment fund, as that many of those two workers that work daily for the employers has not been registered for unemployment, with the result that many of those workers are losing their money and are not getting paid, because you have to understand that many domestic workers will go out, work for a day, work for 2 days, and will get paid. Now, many of those domestic workers has now been retrenched or has been told not to come to work and have no access to any fund. We have we have write several letters to the Department of Labor. We have done submissions, but we had no response on how we can actually help those workers that have no access to any money. Also, the Solidarity Fund that was created for the domestic workers or for the vulnerable sector. They have no access to it because, A, you must understand, domestic workers don't have smartphones, domestic workers are not technology inclined. So, actually, domestic workers are the worst off in this COVID-19 epidemic.
Okay. Thank you for those answers, Myrtle. And you've touched on a lot of some of my questions. One on the UIF. We know that the field of domestic workers remains unregulated as an industry. So
Yes.
how are you trying to get, you also touched on a good point that a lot of domestic workers don't have access to smartphones. So you as an organization, how are you making sure that this information gets to the people on the ground, the people that need it the most?
I think, it's like you asking me the question, it is very hard for us. There's about 3 organizations that trying their best. There's the ISWE organization, there's the UTWUSA organization, and all of us is trying our best. Firstly, to get hold of food parcels, which we're not getting, and secondly, is to get hold of, to get into the Solidarity Fund. But we just can't get into it. However, Satsavu has started for our own members to try and set up some crowdfunding for our own members with somebody from internationally, but you can't help all the members. You can't help everybody. And sometimes we feel, you feel it's a bit unfair. You can help the members of Satsavu maybe, but you can't help the masses out there that is hungry. So we are trying our best to see, and we have sent a letter again to see how we can get domestic workers onto the Solidarity Fund, because there's an open line that say you must dial this number. Also, like the big, yes. So there's no way that we can get to Solidarity, and if you say, so there's no way we can get access for domestic workers, like in one village, the domestic workers try to get some food. When they get there, it was finished, the food parcel.
So you mentioned that you've written a few letters. Is that to the Department of Labor? Who are those letters directed to, and what has been the interaction like? Has government been receptive to your calls and pleas to get assistance for domestic workers?
Yes. I think that I'm not sure how we're going to solve this problem for the domestic workers. However, what we do know is that after this COVID-19, we're going to have a big problem of getting domestic workers back to work or getting some support for domestic workers.
Under level 4, we understand that there are some domestic workers that can go back to work, like people that care for the ill or mentally ill people. So with those, how do we ensure their safety? Like we've received some reports where some domestic workers feel that they're not working in a safe environment. What rights do they have? Can they then leave? Or who can they call to report issues?
Yes, there is many domestic workers that is working at the moment. That is the sleeping domestic workers. And we have appealed to employers to make sure that domestic workers are protected by providing gloves and masks for domestic workers. But what also struck me is that yesterday when I went out of my door, I saw some domestic workers walking actually to their workplaces, and there's a concern about that because according to the government and the lockdown, domestic workers that are sleeping out should not be traveling every day to their workplaces because they will only fall under level 2. So like last night, we had a call from a domestic worker that say her employer say she needs to return and she must bring her little child with. Now the problem is this: what protection is that employer giving to the domestic worker and her child by traveling all the way? So our message is clear. If you want your worker to work, you have to see that your worker is protected. You have to see that you have gloves, and you have to see that it's a safe environment that she's returning to. Because the domestic worker will also have the employer coming back at night, so it's both ways they have to protect themselves.
How many members as Satsao do you have currently? How many people do you
I
represent?
think at the moment, Satsao has had about 124 dismissals from our 5,000 workers that we currently have. 124 dismissals, and only as far as we concerned, we only had about one domestic worker that's been infected, but then in the end she was negative. So Satsao at the moment, yesterday we've got about 22 calls from domestic workers that has been told to stay at home and not come to work. And, but what the employers does, they send WhatsApps to the workers to say to the workers, sorry, don't come in. Sorry, it's no work, it's no pay. So in a moment, we have a lot of WhatsApps from domestic workers sending it to us to tell that employers tell them to stay at home and not come to work.
With those employers, what leg do they have to stand on, seeing that this field remains unregulated? Can you perhaps share some resources and numbers that they can call should they want assistance from your organization?
Yes, they can call. They can call that my phone is open all the time, and they can call, and we also assist them with queries at the CCMA and at Labour, and we try our best to help domestic workers, so they can call me on my number, on my cell number.
Okay, we'll share those on the screen for our viewers. Myrtle, do you have any last words just before we wrap?
Sorry?
Do you have any last words just before we wrap?
I think all that we would really say is that, protect your worker, and the workers must also protect themselves, and that we must look after ourselves during this period.
Okay. Thank you very much, Myrtle. That
Thank
was
you.
Myrtle
It's a pleasure.
Vidboy, the General Secretary of Satsao. They are a union that represent domestic workers.
With the national lockdown already causing a huge knock to South Africa's economy, various workers are now expected to rely on various relief funds provided by the government, such as Unemployment Insurance Fund. This has highlighted the plight of the country's vulnerable employees, such as domestic workers. Cape Town TV's Stephanie Pitt spoke to a researcher for the Socio-Economic Rights Institute of South Africa, Kelebungile Kunau, for more on this.
Good day and welcome to the Our City COVID-19 show. This morning I'm joined by Kelebogile, and she is a researcher for the Socio-Economic Rights Institute of South Africa. And they are an organization that aims to challenge inequality and also highlight socio-economic rights. Welcome, Kele, and thank you for joining us.
Thank you so much for having me, Stephanie.
This morning, we'll be talking about the spate of domestic workers during COVID-19. Now, Kele, when the president announced the national lockdown, we knew that South Africa was about to face a huge economic hit, and we inevitably knew that there were going to be businesses that will close down and people are ultimately going to lose their jobs. But at the bulk of all of this, we find our most vulnerable, and they, in essence, are your waste pickers and your domestic workers. But as we start of this discussion, what are some of the legalities when it comes to domestic workers in terms of labor regulations?
So Stephanie, like you rightly suggested, that the the most vulnerable workers were affected adversely during lockdown. And I think one of the issues was that the regulations that cover domestic workers, such as your Basic Conditions of Employment Act, your Labor Relations Act, and the sectoral determination, which talks about the standard of employment for domestic workers, were already regulations that were very difficult to enforce, even before the lockdown. So post or during the lockdown, the situation of domestic workers became even worse because all of the labor protections that they need to be able to survive this time were not there previously and are not here now.
Yeah. So as we saw that, most people are in actual fact losing their jobs, and it is important for one to have a backup plan for any person in any job. But what is the importance of social protection in the workplace, and specifically for domestic workers?
So, like you rightly mentioned, social protections it's like a safety net. They're described as safety nets for situations like this, or when it's for a situation where a worker finds themselves unemployed, or they find themselves dealing with illness, for them to fall back on during trying times. And the lockdown and the COVID-19 crisis is that time.
Yeah.
And unfortunately for domestic workers, the labor protections that SATSAO, the Domestic Worker Union, has fought so hard for, so the UIF, is proving to be a challenge because domestic workers were not, a lot of employers of domestic workers did not register them.
Yeah.
And as the Department of Labor continues to explain the different interventions to support workers at this time, it became very clear that those workers who were not registered by their employers will not be able to benefit from the social benefits that the Department of Labor is giving other workers.
Yeah.
So the situation of domestic workers at this time is quite difficult because they are entitled to receive these benefits from the Department of Labor, but the thing that is in their way is the fact that they were not registered by their employers in the first place.
Yeah, and a lot of domestic workers have been excluded from various benefits, like they are receiving minimum wage that is lower than any other worker, and also being excluded from compensation for occupational injuries. And we've seen this as a trend across the spectrum. But in COVID-19, is the situation amplified or highlighted to actually show the irregularity and inequality when it comes to the different types of working sectors?
Yes, so even before the crisis, the domestic workers were in general worse off in terms of their labor protections being upheld. So like you rightly said, the first thing when you look at minimum wage, they got a minimum wage that was lower than other workers. They were not covered by the Compensation for Occupational Injuries and Diseases Act, and they had to fight for years to be included in unemployment insurance. And in general, under normal circumstances, it's very difficult for the Department of Labor to enforce these things because a lot of employers are not actually complying, but they are, unlike other employers in other sectors, the workplace of a domestic worker is a private household, so it becomes a little bit more difficult for the department to enforce them. However, when you now fast forward to the time that we're in, all of these different factors that have put domestic workers at a disadvantage are even more amplified.
Yeah.
So when some workers contract COVID-19, for example, in the workplace, they're able to claim for the compensation fund. Domestic workers aren't able to claim for the compensation fund. And as I mentioned earlier, if employers did not register their domestic workers for UIF, they're now put at a disadvantage because they're not able to claim for the benefits that the government is issuing out.
And in many instances, we find that when a worker is not at work, they are generally placed on unpaid leave, which means they don't get a salary for the time that they are at home. And we know that domestic workers are scheduled to be phased back into their jobs only at level 2, and we are only in level 5 at the moment. So on who does the onus fall to ensure that domestic workers are protected in these times? Does the onus then fall on the employer, or does the onus fall on the Department of Employment and Labor?
I think the Department of Labor and employers hold equal responsibility for what happens to domestic workers during this time. On the side of employers, the first thing that they needed to have done even before the lockdown was to have registered their their employees for UIF, right?
Yeah.
And so their failure to do that has put their workers at a disadvantage. And my feeling is that they should be held accountable for failing to do that. On the other side, the Department of Labor is the institution that is supposed to hold these employers accountable. And it's been a problem that many, like the domestic workers unions and organizations that work with domestic workers have highlighted for years and years, that the department needs to find a way to ensure that employers are held accountable for failing to do things like apply for UIF or pay minimum wage. So I think the responsibility falls on both those parties.
And like you mentioned, it is a joint effort to ensure that everybody is taken care of. We know that the government has given the go-ahead for some relief packages and for so that people are taken care of in these trying times. Are these packages made readily available for domestic workers and in any other bracket that is not considered very important?
So I think one of the difficulties with the relief interventions that have been announced is that the word domestic worker or the word domestic worker employer has not been mentioned. A lot of the relief packages talk about companies and businesses, and on the side of the relief that we'll be getting from the Department of Social Development, it talks about unemployed people or a child grant or a disability grant. And that doesn't necessarily cover domestic workers.
Yeah.
So you have instances with many domestic workers were actually earning more than what this 350 grant, 50 Rand grant is. And so some domestic workers might be able to benefit from it just by virtue of meeting the criteria that the Department of Social Development will give. But many domestic workers won't. And furthermore, many domestic workers are migrant workers. Some of them are undocumented. And so when it comes to the requirements where you're required to have a South African ID, for example, or an asylum seeker permit or refugee status, domestic workers who don't have those papers will not be able to benefit from any of the relief from the state, which is quite concerning.
Yeah. So how should domestic workers then go about to ensure that they are protected in these times? And how does SERI, your organization, advocate for equality and also help, realize these socio-economic rights?
So I would say that the best way for domestic workers to seek help or protection during these times is to approach one of the domestic workers unions. So at SERI, we work very closely with SATSAU, which is the national union in South Africa that has been operating for many years. Yeah. We also work with the United Domestic Workers of South Africa and an organization called IZU Domestic Workers Alliance. So if you go to our website, you can find an email address or a phone number to call, and we would gladly refer any domestic workers to these organizations that we work with.
Okay. Thank you so much for your time, and thank you so much for the information that you have given us. And there you heard it, viewers of Cape Town TV. You can get involved with SERI. You can contact them and find out how to go about, and they will also connect you with various other unions. Thank you so much for joining us, Kele. Have a good day further.
Thank you so much.
In a media briefing held on Monday with Social Development Minister Lindiwe Zulu, SASSA CEO Busiswe Mamela Kambula clarified the requirements needed to be eligible for the newly introduced Social Relief Grant. This comes at a time when South Africans are bracing themselves to rely on government-provided funds as part of the fight to combat the spread of the deadly coronavirus. This is what she had to say.
It's very critical for us to understand what the criteria is going to be. There are some inputs that we got after the initial announcement by the minister, particularly with regards to the requirement for a proof of residence. We have since changed this in the directives that the minister has just announced, whereby we will need the people's address, even if there's no proof of address, because in many instances your address is linked to your ID in any case, which is one of the documents that we will use to vet whether the person is confirmed or exists or doesn't exist. So the key people that will be able to apply will be those that are above 18. Because in instances where people are less than 18, if they are people that are destitute, it means the child would still be receiving a child support grant in any case. It has to be people that are unemployed, those that are not receiving any income and not receiving any grant. And when we say any grant, we don't only mean a social grant which may be received from SASSA. If you are receiving a grant from UIF because of the dispensation that has been provided, it therefore means that you will not qualify. And those people that are currently students that are receiving NSFAS funding, because that has also not been stopped, we have an ability to be able to check through all those databases to make sure that people are not receiving these grants. And in instances where people are employed, we are going to be able to take all the database that we have and run it through a SARS that will check as to whether those people actually are people that are unemployed, because we know that in many instances people do take chances. The person has to give us, if it's people that are currently living in institutions that are supported by DSD, it therefore means that those people will also not qualify, including those people that are in other institutions of government, like in prisons. They definitely would not qualify. And I would assume that even if they have technology, they will not be able to apply and qualify for this a grant. So the prospective applicants will need to provide the following compulsory information for us to be able to process their application. And this has to be submitted electronically. The team, the technical team, will indicate later on as to what facilities do we have that already exist and what are the other facilities that we will work on. Have to provide your ID number that has been issued by Home Affairs, name and surname as captured in your ID, the gender and disability. It doesn't mean that this is necessarily a qualification criteria, but it's important for us as government, as we roll out this process, to understand as to how many persons of disability have been are actually part of this process, even though the assumption is that most of them would in any case qualify for a disability grant. The banking details, bank name and account number, this is so that we can be able to ensure that as soon as this has been approved, we can deposit the money directly into your account. I believe there's a number of institutions that don't charge people for applying or opening bank accounts, that are going to be doing a number of campaigns to make sure that they create access for people, and that will be done. The contact details that are critical would be the cell phone number, and we don't necessarily need a proof of residential address, but we need your residential address so that we can get a sense as to how many people are applying within one particular homestead, because that is going to be critical for us to also keep control. The manner in which the qualifying citizens can apply for this grant will be as follows. The new WhatsApp line will be 082 0468 553. We're no longer using the old line that we used, which is part of the health line. We now have a SASSA line specifically designed for this particular grant. Because we know that not everybody has a smartphone, for those little phones also one can be able to apply. We have a USSD line, or what we always refer to as an SMS line, which means we'll have to type in *134 *7737#.
We are now taking a short Global will update us on the latest social media.
Welcome back. Before the ad break, break, we had Michaela Miller with the latest news. Lockdown has resulted in many learning new skills and polishing old ones, from baking to cooking and DIY activities. The city of Cape Town has made a video on how to make a squeeze bottle with a 2-liter bottle, scissors and a tubing pipe.
Hi everyone, my name is Kelly and I'm from the city of Cape Town, and today I'm going to show you how to make a squeezy bottle, and it's an easy way to wash your hands, save water and increase hygiene wherever you are. So what you'll need a 2-liter bottle with a cap, a tubing pipe which you can get at the hardware store, and a scissors or a drill. So what you're going to do next is that you are going to take your cap from your 2-liter and you are going to make 2 holes on top. You can either do it with a scissors or a drill, but remember you need parent or adult or teacher supervision to make the holes. So putting your squeezy bottle together, you're going to take your tubing pipe and you are going to slide it into the hole. It needs to be a little bit tough so that you can ensure the pressure of the bottle at the later stage. So you push it through, then you fill your bottle with water, which I've already done. Place the tubing into the bottle and screw the cap on. There you go. Close the hole above and you're going to squeeze for the water. Release your finger to keep the water flowing. So now that our water's running, I can wash my hands, and the first thing I'm going to do is I'm going to wet my hands, and thereafter I'm going to use soap, where I am going to foam my hands, as you can see, for 20 seconds, so I can get all of that bacteria off. And while I'm doing it, we can sing Happy Birthday song twice, or we can sing any of our songs. It's going to take us 20 seconds to sing, and thereafter, as you can see, I'm going to rinse all of the germs off. So once I'm done rinsing my hands, all I have to do is lift the tube up for the water to stop, and then I'm going to dry, either shake my hands dry. I can use a clean towel at home or even paper towel to dry my hands, so you don't contaminate or make your hands dirty again if you wipe it on your clothes. So wipe it on your clothes is a no.
And now for social media. Share your thoughts with us on Facebook, we are OurCityCT, and on Twitter at OurCityCT. These are the popular hashtags on Twitter today. Hashtag International Nurses Day. Humanity's frontline. That's why nurses around the world are being celebrated today as superheroes. The world is thanking them for their extraordinary service, selflessness, and bravery. Hashtag China. Are there any reasons China is not trending right now? The US has accused it of hacking into vaccine research, while China says US is spreading lies about the origin of the virus. China and India has ratcheted up the dialogue over their mutual border, and there are new cases of coronavirus in Wuhan. After the outbreak, we'll be crossing over to Michaela Miller, who will share information on resources and places of safety that you can use during this period. Stay with us.
Welcome back. You're still tuned into Our City, the COVID show with me, Michaela Miller. Before the ad break, Octavian Glover looked at what has the nation buzzing on social media platforms. For your latest news around the COVID-19 pandemic and to see what other Cape Townians are doing to keep safe, tune into Cape Town TV Daily. These are some organizations helping communities stay safe during this period. That's all we have for you today, but if you have something to say, we want to hear from you. Send your comments, news and questions to us via Facebook at Our City CT, on Twitter at Our City CT, or get in touch with us via our email on ourcity@capetowntv.org. You can also call us on 021 448 0448. From me, Michaela Miller, and the Our City team, goodbye.